Welcome to Issues and Answers with your host, Diane Kinderwater. Issues and Answers is presented as a public service to inform, educate, and better the lives of New Mexicans. And now, Issues and Answers with your host, Diane Kinderwater.
Welcome to the program. I'm Diane Kinderwater. Raise your hand if you're feeling some sort of back pain. Or I shouldn't say maybe raise your hand, maybe feel your lower back, massage it like I always do, hold my hand there. Or how about if you're feeling some kind of neck pain? You don't have to raise your hand, just feel that neck. Well, 80% of Americans, 80% have some form of chronic back pain. On the program today, we're going to discuss relentless back pain and what we can do about it. We have our favorite doctor, Dr. Patrick Nuzzo, here with us today, telling us what kind of back pain is there. I mean, you're probably part of that group. Is a group that you really don't want to be associated with, but if 80% of us feel some kind of chronic back pain, we're probably part of the group. What kind of back pain is there? Sciatica pain, upper back, lower back, neck. What is happening to us as Americans? But more importantly, what can we do to avoid this relentless back pain that just doesn't seem to go away no matter what we do? Please stay with us as we have some answers right after this. Okay, hopefully by now you've called your husband, your kids, your brothers and sisters in to watch the show because you know, you've heard about it, their back hurts. We don't know if they fell from a ladder, that would be really a bad backache, or from the stress of sitting at the computer. I think that's what texting, here that's it, text neck. This is it, when you text all day long, actually it's with the thumbs, that's the problem. You get all these sorts of things that Americans are getting. If you remember when you're back as a kid, remember playing outside, playing tag and hide and go seek and running around the neighborhood, riding your bike? Kids, they're not, do you see them in your neighborhood doing that? I don't see them. I think they're inside with their phones, with their video games. So society has changed, and 80% of us have some kind of back problem, and we all know the neck problems, probably from those kids who aren't on their bikes or in the house. But Dr. Patrick Nuzzo from Southwest University of Naturopathic Medicine is with us to share relentless, and I say relentless because I have a family member who has this relentless, going on a year, back pain. Yeah. You've seen it. You've seen it in your clinic. You see it as your students are teaching, and you have some senior citizens coming in as their patients. Yeah. I'm not the expert. What I know is what I learned from your book, Naturopathic Manual Medicine of the 21st Century. That's why I know what I know, other than hearing about people say, oh, my back hurts. Yeah. As a doctor, what do you see? What are the changes? So take it away, Dr. Patrick Nuzzo.
I mean, back pain. You said it. 80% of people feel some sort of neuromusculoskeletal pain, whether it's mid-back, low back, upper back, neck, whether it's shoulder, whether it's hips. The thing that we have to understand is it's all connected, right? Because the body is all connected. I'm a naturopath, right? Naturopathic and chiropractic started together. I'll just give you a little bit of history, give your viewers a little bit of history. You know, more than 100 years ago. So the philosophy and the education of the nerve flow principle, right? Nerves come off the spine, they team up with blood and lymph, and then they take that blood, nerve, and lymph to all different parts of the body, okay? And there's dermatomes off the spine that come off the spine, and then they kind of oversee different regions of the body or different sectors of the body. If those neurovascular bundles or if those dermatomes are disturbed by stress, by inflammation, by, you know, the body tensing up because of, you mentioned it, repetitive motions. People sit all day long at a computer, at their desks. A lot of these kids are texting, and there is, you know, we get kids coming in with, you know, the mothers will call and say, my son has text neck. You know, it's like, they've already got a name for this. These kids, and I'm talking about young, you know, teenagers.
The moms are calling in and saying their kids have, meaning what? The kid can't raise his head, or what's going on with
pain.
It?
He's got headaches, and you know they can't move.
A kid.
Always. Well, if you sit down 3-4 hours a day and you're texting all day, and you know, let's face it, you know, these last months and year, you know, I have a 13-year-old son. All right, I have a 13-year-old son, and we did a really good job for the first 10 years of his life, first 12 years of his life, managing screen time and managing, you know, how much time we let him be on a phone or on video games. Pandemic came, that all went out the window. I mean, the only communication these kids had was their computer, right? They're in school, they're on the computer all day long. What am I going to do? Tell you can't do that? So he's at desks, he's at my kitchen table, he's, I mean, they bounce around, right? They're in bed on the computers. So these kids have had such a shift over this last year that, these problems are becoming not only acute, but chronic. They're being constant. And not only the kids got disrupted, but all the workforce got disrupted. They went from their cozy, ergonomically situated offices to their coffee table, to their sofa, to their kitchen table. Bad ergonomics, right? And whatever pain they may have had is now exacerbated because they are now doing something that's creating more stress, more tension, more pain, right? So I said it's all connected. And it's connected because we are connected truly by connective tissue, right?
Yeah, that's the word, connective tissue. Okay.
Right. And the body is ligaments, right? Ligaments hold bone to bone. Tendons hold muscle to bone. But besides that, the most prevalent connective tissue is called fascia, interstitial tissue. So there's a layer of muscle, there's a layer of fascia, there's a layer of muscle, there's a layer of fascia. So when you turn your head or you move your shoulder, those muscles should glide over that viscous, gooey fascia. Because in its natural state, fascia is viscous and gooey, so it's lubricating. Stress, dehydration, repetitive motion, poor sleeping positions, poor sitting positions tend to dry that fascia out. And when that fascia dries, instead of it muscles rolling, it acts like a fulcrum, right? And as you move then, the fulcrum happens and it pulls bony structure out of alignment.
Ah, that's where we're getting to.
So it pulls
we're pulling the bone,
right,
or spine, or vertebrae.
The spine or the joint or the hip, because it acts as a lubricant. But if it's dry, it doesn't do its job anymore. The body compensates, and when you move, again, it's like a fulcrum. It pulls vertebrae out, it pulls shoulder bone out.
Just because the fascia isn't lubricated to
it's
keep
not
it
doing its job. It's not able to have its
a
range
simple
of motion.
So what are some of the simple instances where you can get back pain? Let's start with a simple and then go to the...
Well, simple. Sitting in a bad position over and over again, for...
Can give you lower back pain.
Well,
Okay.
like if you're not at a really good ergonomic
Okay.
position, sitting up straight, if you're slouching, if you're looking one way or the other at a computer, let's say you're on your screen and you're looking this way
Yeah.
at the screen, right? You start to get after an hour, you ever been on an airplane and tried to talk to the person next to you on the
And then
airplane?
when you get off,
You can't move, right? And that's just a short plane. But
Yeah.
if you don't, it's not as extreme when you're looking at a computer.
what types of
but it's over and over.
What types of back pains do you see at Naturopathic Medicine of New Mexico?
I mean, from headaches and aches to degenerative discs and herniated discs that people tear tissue.
So they're not just accidents, and we can talk about accidents, car crashes. We have Michelle here who said she fell out of a raft
Right.
and hurt her back a few years ago, but still from time to
Hurting.
time. Why is that?
Well, just-
falling out is a jolt. Ooh.
She got the jolt, no question. She probably got herself out of alignment a little bit. Inflammation probably happened down in that hip area. Inflammation happened, dried out the fascia. Fascia then adheres. It's just tight, taut tissue. So the alignment probably never came back to where it should be because of the jolt that she had, right? So every time she moves a little funny, she can get a little bit of aching, right? It's not something that debilitates her. She talks about every now and again, I still feel it after 3 years. But some people have a fall, right? Some people will fall and they'll jolt it out so bad that they're in constant pain because they jolted it out enough to where that musculature may be closing down on one of those neurovascular bundles. You got a little impediment on that nerve, and it's like a hot poker. Every time you move, you're going to jolt. Every time you try and reach, you're going to jolt because that tissue is in a bunch.
What about, I gave you the case of my brother Mark.
Okay.
Sadly, 11 months ago, got a supermarket sliding glass door wasn't operating correctly, and he walked through it, and it hit his arm. I mean,
Boom.
jammed him.
Okay.
But he feels the pain in his back.
Well, think about it. Here's the spinal column, right? A nerve comes out of each one of our vertebrae, right? Goes to different parts of our body. He got jolted. The vertebrae got jolted. The whole body got jolted. And it could have very easily gotten knocked out of alignment, right? Inflammation starts. Inflammation starts. And when inflammation starts, the tissues and the bony structure hold in that pattern. More than likely, he's so out of alignment that those nerves are being impeded on him, so he has no relief. He's in constant pain. Nobody has gotten in there and gotten that vertebrae to come back into alignment, right?
And it got out of alignment, but because of the dried fascia.
Because, after time, he probably felt the jolt, right? And I don't know, you haven't told me this, but probably after a week or two, the pain got worse. The pain got worse because the inflammation started, infiltrating the area, infiltrating the tissue around the nerves, right? And then the nerve gets squeezed off. If you're putting pressure on a nerve, there's pain. I don't care. This poor guy, if he sneezes, he probably feels a jolt because he's got compression on that neurovascular bundle, right? And, medication, unfortunately, you'll deaden the pain, but it doesn't do the correction. You've got to get that vertebrae back into alignment in order for those nerves to come off unimpeded. So the inflammation comes down and the circulation gets back to normal, right? If circulation gets back to normal, pain's going to go away. Right? It's not an easy, you can't just get one treatment after somebody with 11 months, but we got to do some posture stuff with him. We've got to make sure that he's staying hydrated so those tissues can get lubricated again. There's a lot of steps that he would have to do. He would have to do some corrective exercise and stretching every day because after 11 months, the muscles, they have a memory, right? So they're in this position of constriction because he got hit so hard, right? So that whole body has compromised itself and adhered to the injury, right? And you've got to undo that. His body has got to come back. Now,
what about people that they should see then a naturopath right away?
Well,
I mean, not waiting 11 months. You got to take care of it. So if people are aching, don't let it go because I just learned from you, muscle memory, your muscle's going to stay that same way.
And it's going to get worse because the body compensates. So anytime there's an injury, anytime there's a fall, anytime you step off a ladder wrong and you jolt yourself, the body takes a little bit of a hit. So you either have to stretch yourself out, get over an exercise ball, roll out that spine, stretch out the legs, do some yoga, right? Or find a manual therapist that can help put this body back into alignment.
The pain usually, Dr. Nuzzo, is it usually because the vertebrae gets misaligned? Is that, and then starts the circle?
The vertebrae gets malaligned. The nerve gets impeded a little bit by that happening, and then the muscle starts to constrict a little bit. The fascia dries out around that muscle.
And then it stays constricted.
Exactly, and that bundle is interfered with.
What about people seeing a chiropractor?
Absolutely. I mean, chiropractors do, napropaths and chiropractors started together. The philosophy, the education, almost identical. What broke the founders apart was the way we treat. We don't just do bony alignment, okay? We do bony alignment, but we do bony alignment by treating the connective tissue that's pulling bony structure out of alignment versus just trying to get on that bone and put it back into place.
Because if you put it back into place, it'll just get misaligned if you don't.
Well, again, the tissue's going to be pulling, right? If you didn't correct the tissue that is pulling that bony structure out of alignment, as soon as you adjust, whether it's an hour, whether it's a day, the body's going to come back to it. Right.
Well, but first it starts with the misalignment. If you fall, the vertebrae gets misaligned, and then it's the fascia and the things that
start to inflame, right? Because you
and
get
keep it that way.
exactly.
Okay.
Exactly. And it wants to go back into alignment because the body has homeostasis. It's always looking to go back to a normal state. But if you've got inflammation or you've got a torque, right? If you've got a torque on the vertebrae from the muscle because the fascia dried out, how does it go back into alignment? You can't force it in. You've got to untie the tension that's pulling it out of alignment.
And the fascia not to dry out, simple as just drinking water?
Well, I mean, that's a huge part. Fascia,
keep it lubricated,
and keep it lubricated. You could do that by hydrating and great diet. But you also have to, the body has to be in alignment, right? You can't sit at a desk all day long like this and have your fascia in alignment. It just doesn't work. You've got to be in a great posture. And if you're at the desk all day long, you got to take breaks throughout the day and stretch and drink water and walk and move your body. You got to get that circulation moving.
What we discussed lower back, but there's is lower back the most common? I mean, you hear people say my lower back hurts.
Lower back is most common because, that's where the hips come together. It's a pretty complicated instrument, right? You got the hip bones tied into the bottom of the spine, the sacrum, the sacroiliac joints, right? Big ligamentous, structures that hold the hip bone to the bottom of the spine, right? So there's a big joint in that area. So bending over, right, and not bending over properly wears on that joint, wears on those vertebrae, wears on those discs in that vertebrae. If there's extra weight on people and they have a belly and they're pulling that vertebrae forward, right, it's pulling it, gravity is pulling you out of alignment. Standing up, gravity comes down. You're pushing down on, people talk about, well, I used to be 6 foot, now I'm 5'10", right? Or I used to be 5'7", not me, I wasn't 6 foot. But you're 5'7", you lose an inch, right?
Yes.
You shrink. The body shrinks. Gravity pulls you down because of posture. You don't have to have that happen to you, right? I do things every day, to stretch. I mean, I even use inversion every day to where I get on an inversion table and I let my spine stretch out. I let my organs fall back down into place.
In between the vertebrae that's
there's a vertebrae, a disc, a vertebrae, a disc.
But that's what's compressing to...
Yes. Well, that disc can bulge, right? And they're designed to bulge, right? Because it's like the jelly in the jelly donut, right? If you squeeze on one side of that jelly donut, the jelly comes out the other side. The same thing happens with the disc. Discs are designed to bulge. They're shock absorbers. So if you get tension on one side of the body and it pushes that disc out, more than likely what happened to your brother. If I saw your brother's MRIs, I'd probably see bulging discs all through the cervical and thoracic area due to the impact on the shoulder.
Just on the shoulder into the back.
Well, just think about that kind of a jolt. Just think about that kind of a jolt. And if you're not expecting it, you're not bracing yourself, you're just a sitting duck. He's probably walking, minding his own business, bang, right? It just throws you. And it threw him enough that he knocked that thing out of alignment. Those discs are bulging. Those bulging discs are nicking one of those nerves, which makes the nerve constrict, which makes the muscle constrict, which makes the fascia constrict, right? Then that fascia, because you're not getting good circulation there, starts to dry. It
holds it in
then
place.
You form knots. Like people say, I got knots in my shoulder. That's dried out fascia, right? It's dried out fascia. And that area is not allowing you to move freely, right? And every time you move, it's pulling that bony structure out of alignment because it's not, has that free movement in and out. So,
what about, we talked about chiropractic, what about physical therapy? And I read in your book, you said perhaps sometimes a therapy from a naturopath, you can feel the results in 1 or 2 sessions, whereas physical therapy, they don't do even the diagnosis, it's from a doctor, but it could take 8 or 10 sessions sometimes.
Sometimes, yes, and that's what they normally will prescribe. You get a prescription for physical therapy, it's usually 6 to 10 sessions, right? Physical therapy and naturopathy, physical therapy obviously has its place in the medical world, but it's more about rehabilitation, about getting people range of motion back after falls, after surgeries. They don't get in and do bony alignment like a chiropractor would or like a naturopath would, right? That's what our focus is bony realignment. Physical therapists are rehabilitation. I want to get that joint 100% again. I want to get that range of motion back. But they're not taking it back to the spinal column, right? And that's a missing component. You know, even in chiropractors, I mean, I love manual medicine. Everybody should have manual medicine, but there's shortcomings in each of these fields. And in chiropractic, they understand bony realignment. They don't understand, let's treat the connective tissue to take the pressure off that bone, so when I make that adjustment, it's going to hold. It's going to hold. Right? Or a massage therapist. I mean, massage therapist is wonderful for stress and everything that's going on. They'll rub out and they'll work on spasms in the body.
They get things
flowing. They'll get circulation going, right?
To carry weight.
But they didn't go back to the spine to correct the vertebrae that created that spasm to begin with.
So
right?
it feels good for a short time.
Yeah, it
but
feels
it's gonna
great.
go back.
But we want to. It's corrective. It's corrective. Can I read something?
Sure.
You know, this is in the.
What page?
You know, it's right at the start of the book here, and this is really from Oakley Smith was the founder of nephropathy, and. You know, I want to talk about this because this is in his 1917 book, and it's called Naturopathic Chartology, all right? And naturopathy represents the world's first charted manipulative methods, okay? Naturopaths, by charting their diagnosis and manipulation, place themselves in a class alone. The first attempt in the field of nephropathy to chart all manipulative procedures represents not only one of the beginning points of the science of nephropathy, but represents the very beginning point of scientific manipulative therapy. Scientists have always been prone to cast to one side any modality that was not closely interlinked with evidence of scientific detail. And this is why this doctor told your brother that, you know, don't think about it, right? Possibly it's for this reason that manipulation as a means of cure was passed over by science. If such reason is correct, the introduction of naturopathic chartology, with all its wealth of scientific possibilities, will furnish every person of science full expression for their greatest talents. So naturopaths,
So in a layman's term,
naturopaths align bony structure. We chart the bony structure. So we teach our interns, our doctors, they will take a grease pencil and they will mark that spine, okay? And we'll find out if that spine is, you know, anin or poin, you know, anterior, posterior, to the left, to the right. Is it twisted? Is there fascia tension there? And by looking at that, we can then chart a treatment that will take in consideration all the connective tissue that's pulling that bony structure out of alignment. So we can scientifically chart the results of a naturopathic treatment from first treatment to end treatment, right? And you can, you know, get, you know, subjective feedback from your patient they'll tell you, I feel better, my pain is gone. You know, headaches, huge. I mean, I've seen more headaches in the last year than, you know, ever in my practice. And most likely because, you know, people are stressed out. I mean, everybody's worried about the pandemic. Everybody's worried about their health. But sitting at that computer and being stressed out, you know, everything, you know, nerve, lymph, and blood run down these channels and drain into the thoracic ducts. You have nerves coming all out of these cervical vertebrae. If that tension closes down on those nerves, circulation gets diminished. Drainage from the head gets diminished. Pressure builds, headaches start, right? You have to open the flow. You've got, I kind of make jokes. It's like cleaning out the gutters. If you go and you clean out the gutters of tension, circulation moves. Headaches go away.
sciatica.
Sciatica.
A lot of, actually, my friend's husband has it. I think somebody at the studio mentioned sciatica.
Yeah. Sciatic nerve is the largest nerve in the body, okay? It exits at the hip and it comes off the lower lumbar spine, the lumbar plexus. A big thick nerve comes down the leg, innervates the entire leg, okay? Sciatica usually will start in the lower hip because the musculature has closed down. And sciatica normally runs because that big SI joint, that sacroiliac joint, people sit cross-legged, people sit poorly, they sit like this, they sleep on that side. If you have enough repetitive motion or enough pathology, right, that tissue starts to inflame enough and it gets that sciatic nerve, you got a problem, because it hurts like heck, because that nerve is that thick, and every time you move, it's like getting a jolt. So in sciatica, we've got to line up the spine, you got to line up the hips, and you got to open the neurovascular bundles. So you're working the tissue in the leg, the back of the knee, all the way down. Some people get sciatica all the way to the bottom of their foot. You know, that means that somewhere along that sciatic nerve, that nerve is really being squeezed off, right? So you got to get in there. You know, like we could align the spine, but we also have to find where that tissue is being squeezed on the nerve. So, you know, it's neuromuscular tension.
When you say neuro,
Nerve, muscular. Every naturopaths treat neuromuscular tension without drugs.
and when a person takes ibuprofen, it's a short-term.
It masks it. And thank God people have.
Brings that down, the inflammation that takes the pressure off the nerve, but then it comes back after the medication is gone.
Exactly.
Okay.
And then
so you need to get the constrictions out of there.
Right. You got to get circulation. You know, we are anti-inflammatory medicine.
Our bodies are ourselves.
No, I mean, as a naturopath, right? We don't use drugs. We do inflammation reduction by increasing circulation. When somebody comes to my office, they come with sciatica. I don't just treat sciatica. I treat the entire body because everything is connected, right? Because you have sciatica pain, you're sitting, your posture is off, because you're in pain. You have got to realign. You've got to bring circulation back. You've got to open that flow.
That's what I've learned. Once you compensate for one injury, then you're causing injury to another part of the body.
Exactly, compensation.
We're going to have you back, Dr. Nuzzo, regarding, you've been here for how long now, Southwest?
Well, we opened
the University of Naturopathic Medicine, but also your clinic.
We opened the clinic in 2004. We opened the school in 2010. We've been around a long time.
And you haven't been any busier.
And it's as busy as I've seen it right now. People are understanding. People don't want to take drugs anymore. People don't want to take drugs. Look at this horrible opioid epidemic, right? People are understanding that, pain isn't a shortage of medication, right? It's not a medication deficiency. Pain is inflammation. Pain is malalignment. You got to address that. Medication masks that.
Fantastic. And our next show, we're going to ask you the simple question of how should we be sleeping in our bed? So that's a little tease for the next show, right? I learned from you, don't sleep. I got constriction in my arm, don't sleep on my arm. Well, I like to sleep on my arm, but then it won't go away. Right. Dr. Patrick Nuzzo, thank you so much for being a part of this.
Yeah, I really enjoy working with you, Diane.
And the back,
yeah,
we all have it, but we can get rid of it.
Yeah, we can do something about it besides medication.
Very good. Thanks for watching. We'll see you next week. Bye-bye.
Issues and Answers with your host Diane Kinnewater is presented as a public service to inform, educate, and better the lives of New Mexicans. To comment on today's program or to purchase a copy of any Issues and Answers program, visit sunbroadcasting.org or call us at 505-345-1991.